Good evening. My name is Harish Khare and I'm the current chair of Media Foundation. A very warm welcome to all of you. Media Foundation, as perhaps some of you may know, is one of the oldest media group in the country, and it was founded by Mr. George Burgess and other high-minded editors after the unfortunate experience the media organization and individuals had during the emergency. The idea was to bring together a group of not just media people, others who were committed to the principle of free speech, creativity, and expression. And we do a number of things, but we take great particular pride in giving the Chameli Devi Award once a year to the best women journalist. And we also had a Vijay Varghese Memorial Lecture every year. In recent months, we have started a new activity. We call it the Media Dialogue. And the idea is to pick up one area of concern where public interest, media interest, professionals, burning issues, bring together, hold a conversation. This evening, we'll be talking about public health, and this is the most, one couldn't think of a more topical subject than this, because we are in the pandemic age, which a disease which has crossed all kind of fault lines. It has made its presence felt among the most powerful to the lowest person in the land and probably in the world. So we are here to talk about public health, what it means in terms of great policy choices. How does India as a nation, as a society, as a democratic system, we look at public health and the attention of resources, intelligence, capabilities, capacities, all those issues come into play. And we have put together a very exciting panel this evening. And I would request Geeta Seshu, she is one of our senior members of Media Foundation, and she is with Free Speech Collective. She will introduce the panel and carry the conversation forward. Geeta ji.
Thank you, Mr. Khare.
Yeah.
Good evening, all. Welcome to the Media Foundation IIC Dialogues. Around this time last year, we were already 2 weeks into the 21-day lockdown that was expected to buy time to bolster health services. The COVID-19 pandemic has forced us to confront the real state of public health services in India. Access to affordable, quality healthcare for all, especially the most vulnerable and marginalized, is critical today. But now we are in the midst of a huge surge in cases as we grapple with reports of dwindling vaccine stock, a shortage in beds, in oxygen, medicines, and face yet another debilitating lockdown. Our government tells us that budgetary allocations for health have increased, even though it's still a fraction of the GDP. There is still little or no access to information, no clear data on cases or deaths, or even on variants. There's no transparency on vaccine stocks. All of last year, we had an unprecedented number of journalists who were either penalized or had cases against them for raising simple issues of misgovernance or administration problems that happened in administration. Public health gaps in the narrative is an attempt to make sense of what we do know and rigorously question what we need to know. Our panelists for today have been tireless in seeking answers, and we hope to learn from their quest. Abantika Ghosh is health correspondent with the online news site The Print and has just published Billions Under Lockdown, the inside story of India's fight against COVID 19. Banjot Kaur is the correspondent of Down to Earth. She has written extensively on public health delivery on the ground, as well as examined governance and health policies. Dr. Amar Jessani is an independent health consultant, researcher, and teacher in bioethics and public health, and part of Swasthya Abhiyan, a coalition of 21 national networks and organizations that work for a people's health movement. As editor of the Indian Journal of Medical Ethics, he has made very powerful and incisive comments on public health in India. Keshav Desiraju was Union Health Secretary and retired as Union Secretary in the Department of Consumer Affairs. He has been an outspoken critic of corruption in healthcare services and on the importance of primary healthcare, community health, and mental health. Co-editor of Healers or Predators, Healthcare Corruption in India, along with Samiran Nandi and Sanjay Nagral, he has recently moved away from health and published Of Gifted Voice, a biography of M.S. Subbalakshmi. Today, we'll begin with the field reports, the field notes from journalists Abantika Ghosh and Banjot Kaur, and then move on to hear Dr. Amar Jessani and Mr. Desiraju. We hope to take a round of questions, so please post your questions in the chat box. We'll start with Abantika right now. Abantika, over to you.
So, when we talk about gaps, the last 1 year actually showed some gaps that we were already talking about, some gaps we did not know existed, and some gaps which I think were just simply functions of the pandemic. If the pandemic had not happened, those gaps would never have mattered really. And these were not necessarily like when we talk about health, we essentially think of health infrastructure gaps. But the last 1 year showed that some our most glaring omissions were actually in public health communication. I mean, infrastructure, we actually did not do badly the way we pulled up our SOXs, the way we did beds, oxygen, ventilators. That wasn't so. Even testing, we started off early. So I was just sort of writing down what are the gaps. Now, one very glaring gap has obviously been urban health. Throughout the last year, even now, cities, Delhi, Bombay, Pune, Nashik, cities have borne the brunt of the pandemic. And this is not exactly new now. It's been over a year that India realized what a folly it was really to junk the National Urban Health Mission plan, which would have had, if that plan had worked out the way it was envisaged in 2013 with NRHM-like structure in cities so that you would have urban healthcare workers, your tracing, basically tracking contacts, and going door to door, all of that would have been very easy. And this is something that is there in a health ministry report where it says that we don't have people on the ground. So that was one, that our cities with their sonky hospitals, in the beginning of the pandemic, we were talking about how China has built a hospital in whatever number of days. Now, I was talking to somebody in the ministry one day, and they were like, I said, but we didn't do that. And he said, even if we had done that, we would not have selected a Bombay or a Delhi for that hospital. And that is where we are falling short. So, how vulnerable our cities are and the gaps in urban health, that's one learning of the pandemic. And then, throughout all these years that I have done health, I have heard this line from the private sector about how much of India's healthcare burden is shouldered by them, which is correct. Yes, they do. However, the pandemic exposed how reluctant they are to count when it matters, to stand up and be counted when it matters. From right so initially there was a lot of angst about private sector testing not being open. That opened up. Private sector was, they were asked to have beds. The rates were regulated. And I think that is where the problem started, because, for whatever reasons, the private sector has not done too much testing. First, they said it was the money. Then they said people are not coming. All kinds of things. They did not do that much health in terms of hospitalization and all that. And now they are not doing vaccinations. I think a couple of weeks back, it was just 16% of vaccinations. So initially they said that we are not testing because it's not financially viable for us. Now vaccines, they are saying we are not getting the vaccines that we can give. We can give thousands and thousands of vaccine, but vaccine supply is regulated. So whatever the numbers are, there is a gap in terms of how much the private sector would step up when the need arises. Then the third gap, I think, maybe the other next three gaps I want to talk about are all related to public health communication. And I think it is a matter of very serious concern when public health communication, your primary public health communicators on the ground are policemen. Policemen who are basically letting their lathis do the talking. That is, I think, as counterproductive public health communication as it gets. And that is just one thing. But starting off, let's just start from the time the lockdown was announced. The way we portrayed the lockdown and the way we said what was our aim in the pandemic, how were we going to control the pandemic, what was it that we were trying to achieve. So when you look at that communication from the start of the lockdown, you see a distinct shifting of goalposts. So first, when the lockdown was announced, immediately afterwards, we were told that this will break the chain of transmission, which was completely ridiculous. But that's the line that, in the initial days, it was just in the COVID briefing, the Joint Secretary talking about it or the Niti Aayog member talking about it. But eventually the Prime Minister himself said, and then he actually said that we will win this battle in 21 days. Like Mahabharat battle was won in 18 days, we'll win this battle in 21 days. I don't know. I mean, and I honestly believe that nobody in the government believed that. But there was this need to compulsively give a positive spin to everything. So, and we were treating people who were so badly hit by the lockdown, who were scared of a virus they did not know. We were basically treating them like nursery kids who can only sort of handle the truth in small packets, small digestible packets. The whole truth, if you give it to them, it'll overwhelm them. That sort of an attitude. And that continued later on. So this we are talking about breaking the chain of transmission somewhere in March, April, end of March, beginning of April 2020. By end April, we are saying, no, forget the chain. And which is when one lockdown extension has already happened. Then we are talking about, forget the chain of transmission. We have done brilliantly because our doubling time has increased. Now, doubling time has increased from where? So when you did lockdown, your doubling time was 3 days. So basically, you were going from 500 cases to 1,000 cases in 3 days. And when you're saying we have done brilliantly, your doubling time is 12 days. When in 12 days, you're going from 1 lakh cases to 2 lakh cases. That's one shifting of goalpost. And then a month later in May, we are told, no, I mean, it was never about the numbers in any case, because an infectious disease progresses in it increases in geometric progression. So this compulsive positive spin is one thing. Then the need to control the narrative. And that is when we sort of talked about, even now, we are talking about deaths, cases per million, but tests and vaccinations are not per million. So this, I think the public health communication is a big gap. I mean, we can discuss it later if you want. And last thing that I want to talk about is the questionable decisions that we took that really shook public faith. This was, be it Dr. Bhargava's letter when he wanted to wrap up a vaccine trial in 6 weeks, or when we actually approved a vaccine without efficacy data. All of these things expose gaps in public health, because public health, after all, is about people. And here we were somehow not treating the people as equal stakeholders.
Thank you, Abantika. That was excellent. I think this important point about public health and especially treating police as the primary health communicators was a very, very good point. Um, we can talk endlessly and perhaps on a separate session about the lockdown on civil liberties because of the pandemic. I'd like to move to Banjot now and ask Banjot, what did you see in the last year and what do you think we should be prepared for as we go ahead? Banjot. Banjot will be wearing a mask through her talk with us because she's in office and she has to be masked. Banjot, please.
Thank you, Mr. Khare, for giving me a chance to be a part of this discussion. Abantika talked at length about giving a compulsory and positive spin to everything that the government was trying to do.
Yes.
That compulsion was such large that shifting of goalpost about the intentions or the targets of lockdown did not end there. If you read this year's economic survey, it says the lockdown was imposed after after taking learnings from the Spanish flu, which happened in 1918. So this one argument we never heard any government official making in any of the press conferences. And all of a sudden, economic survey comes up and says, look, we learned from Spanish flu of 1918 that if we imposed an early lockdown, our cases would be under control and we will, win the fight against the virus. So, when you are talking about science and when you are trying to link science with policy, there has to be some nucleus around which you are trying to revolve. If you keep changing your targets, the worst outcome of this is not that you will not be able to achieve, desired results in the pandemic. The worst outcome will be it will shake the confidence of the people in your policy making, as we see right now, because electioneering on the one side and netas without mask in all those rallies, and then those same netas asking us to wear masks, this has shaken the very confidence of people in the science itself. People now joke that COVID was never a disease, it was an international conspiracy or a national conspiracy. So the worst outcome of this entire strategy of making government appear it is doing best and every decision is just so very good, is the fact that people have lost faith in the science, and that is a really really crucial outcome. uh, Lockdown was given to us, served to us as something which will solve everything. Now we know what happened. Lockdown was imposed when there was some 500 odd cases in India. When it was lifted, we had cases in thousands every day. So obviously, it did not help in bringing down the spread of the infection, or infections in fact went up. It was said that we made enough capacities to produce beds, oxygen beds, ventilators, etc. But look where we are now at the moment. You see the pictures from Maharashtra, you see the pictures from Gujarat, you see pictures from other parts of the India. We are still struggling with the same things with which we were struggling earlier. So we have come to a complete circle, but it still seems that we are still grappling with the same problems that we were grappling in March, April, May, June last year. Uh, about public health communication, I, as a journalist, also feel that it was the worst thing, the worst part of the strategy was the public health communication. Prime Minister told us at one point in time, "Jab tak dawai nahi, tab tak dhilai nahi." Those of us who heard it for the first time knew, because by that time the studies had already come in, that even if a vaccine will come, and I presume by the why he meant vaccine, even if a vaccine will come, it will prevent against, it will save us from the severe disease and not the infection itself. Now that meant wearing masks even after being fully immunized. That meant there was no scope of delay even after dawai. So PM coming on national television and saying elsewhere jab tak dawai nahi, jab tak dhilai nahi, was an error. And then PM had to rectify and say dawai bhi kadai bhi. See, public can't, a general, a person who does not understand science and who is grappling with so many issues, he or she can't process so fast the changes in your sloganeering. And public health communication is not just any other sloganeering. It's a very tough task. It's a task that requires behavioral change in people. So I wished, you know, the policymakers or the bureaucrats who were coining these slogans paid a little more attention to what they were making the PM of this country to say. If we talk about, you know, I remember the press conferences in the earlier phase of the Indian pandemic when we used to question why tests were not increasing. We were told that the positivity rate used to be below 5%, and if the positivity rate is below 5%, we do not need to increase test is not going to be our mantra. It is the same government which after few months, when even the positivity rate remained below 5%, is was asking people to just test. So, you know, just look at the difference in their intentions and in their ideas and in their coinages. How is a common person supposed to process all of this? And this was just not confined to one or two things. There was some loose and I would say unscientific messaging also, and that too from top scientists of this country who work in government sector. Scientists have done brilliant job for us. It's not to belittle their effort, but you know, for example, ICMR DG was asked, and it was me only who asked him in a press conference if there were any cases of Kawasaki-like disease in children who were testing positive for the virus. He said no, there was none. By that time, many cases, not many, but in fact, there were published papers in Indian journals and other journals that children were reporting Kawasaki-like disease after, even after having gotten free from the virus. So I think, I mean, epidemics will come in future also. One of the biggest learnings for every one of us should be the fact that if you are communicating science to people, you have to be very, very careful about it. Otherwise, people will lose faith in the science. You know, Geeta, you were asking me about the experiences which we had in so far while covering this pandemic. Look at the situation now. We have run out of, or we are reporting major gaps in, supply of vaccines. This is the same country which, after launch of the vaccination drive, was reporting vaccine hesitancy, and government had to make an earnest appeal to the healthcare workers at that time that please accept these vaccines. So from vaccine hesitancy, we have come to vaccine scarcity just in a matter of few months. Uh, I'm sure people were in the government sector were able to visualize this, right? If they were not able to visualize this, that we are going to have vaccine scarcity, then there is something deeply problematic with that. It is a fact that had we not have a second wave, the demand for the vaccines might not have gone up. But a second wave would come is something which most of the scientists knew. And a government, if there is a pandemic around, a government is always supposed to keep doing epidemiological surveys, mathematical modeling to understand how the trajectory of virus is going to be in coming few weeks or coming few months, even if you believe that you have already won the battle against the virus. Because if a second wave was there in, almost in every part of the world, there were chances that India will also have a second wave. Was epidemiologists and other scientists in India not doing enough modeling and enough projections for the virus trajectory? If not, that is also a matter of concern. The biggest matter of concern as of date is the very less genome sequencing. We know in Maharashtra, the so-called double mutant, I personally do not like to use this term, but anyways, the so-called double mutant strain is, is causing a major surge that may not be directly linked, but that is causing a surge. Now, once they had declared that there was something called double mutant circulating in Maharashtra and other parts of country, I think a couple of weeks ago, we do not know what happened after that. We do not know if epidemiological surveys were conducted in Maharashtra to establish whether this is driving the surge. We do not know whether studies have been initiated to understand if our existing vaccines would work against this particular variant. We do not know answers to many such questions. If we do not know answers to many such questions, are we shooting in the dark? And if we know answers to these questions, if the government knows answers to these questions, why can't it just make those answers public? Why can't it release all this data? This will instill confidence in people, because otherwise you have, I mean, this all political mudslinging is going on about vaccines. One state is saying we have run short of vaccines. Health minister, union health minister is saying no, you are doing politics. You have enough vaccines. Why not create a dashboard which says that this state has been given these many vaccines, this much has been consumed, and this much is in the pipeline. So if transparency is the key to fighting any epidemic, and so this pandemic as well. For example, there were some very basic numbers which we could never know. The fact that India was doing less than 1% genome sequencing, I mean, when I wrote that story, it took a hell lot of me to get that data. Why can't Indian government come out with data in regularly saying how many? Now they are doing this, now they are sharing how many samples are being sequenced. But before this double mutant virus strain was sort of announced to the media, before that, there was no sharing on genome sequencing at all. So, A, not only we need to ramp up these efforts that we are making, B, we need to be much more transparent about whatever efforts we are making and whatever situation we are in. And C, we really need to improve a lot about the public health communication or the public science communication. Talking about vaccines.
Yeah, thank you.
Can you hear me?
Yeah. Can you just,
Okay.
yeah, uh, do continue if you're winding up with what you want to
Okay,
say?
so I thought there was okay. So if you talk about vaccines, Covaxin, we to give emergency use authorization to this vaccine, we came out with something called a vaccine in clinical trial mode. Before this term was served to public and to the media, none of us actually, probably Dr. Jessani would know more, but none of us actually knew what this whole clinical trial mode was. So, but at that time also, the government could not explain sufficiently why this was done and what this would mean, until and unless journalists went and hounded officials, what is this whole clinical trial mode. Now all of that definitely contributed to vaccine hesitancy, because people would read that the government has come out with vaccine without sufficient data, and this contributed to vaccine hesitancy in general, not just against Covaxin, but vaccine hesitancy in general. So, had government been transparent enough on this, aspect as well, we might not have had to face such great vaccine hesitancy which we faced in the initial few months. Uh, about gaps that you were talking about, Abantika talked about few gaps. These are the gaps that we can see. There are certain gaps which we really can't see. There are millions of children who have missed their schools and thereby missed their meals as well. That will definitely increase our problems of undernutrition or malnutrition in children. There are figures already available by international agencies that the world as a whole will face this crisis. Now, what we needed to do was to understand what is the amount of crisis in India, what is the level of crisis in India. To understand these, I would say, gaps which are not visible, invisible gaps, what the government needed to do was to initiate a study or a research as to how many children were left out and what the impact is it going to leave. A question was asked about this in the parliament, whether government is going to make any such effort to understand this. The government replied that so far, no, there is no any program to launch such a study. So if we do not know the magnitude of our problem, how are we really going to solve it? Or we should just understand that children missing out on routine immunization, children missing out on meals, children missing out on schools is not our priority. A pandemic will come and go, but these are going to leave many long term impacts. So these are the gaps that are not spoken about much among journalists also, I believe. But I believe it's already too late that we start thinking about them.
Thank you. Thank you so much, Banjot. That was really good. And I think what you said about the way in which public confidence has been shaken both in policy making as well as in science uh, is really very, very important. And it's really been a missed opportunity in many ways. And I'd like to ask Dr. Amar Jessani what he thinks about how one could have dealt with this, because scientists and public health activists have been beating their, I think, heads to the wall on something like this for the longest time. Uh,
Well,
Dr. Amar, if
thanks,
you,
Geeta, and yeah, yeah. Can you hear me?
yes, yes,
Uh,
perfect.
oh, yeah, thanks to Media Foundation, Geeta, and Harish Khare for having me here. Let me say one thing. I think that is an appreciation of the media, and that is that before COVID crisis started, we had very few journalists who were covering health. The best journalists will not touch health. They will have some other things, which is more important. But the biggest gap that has been filled up in the media at the moment, to my understanding, is having large number of good journalists really doing uh, uh, in-depth work in the field of health, and some of them have become really very well expert, media person in the field of health. They are not in the mainstream. That is true. Mainstream media is still, remains prisoner of the current government. But there are large number of this young and middle level media people who have changed the report, the way health is reported in India. So first, I'm very happy that they are all connected to the Media Foundation, and they are being nurtured. What I'm going to do is make three major points because Abantika and Banjot have covered a large ground. I don't want to go back into that. I'm more or less in agreement with both of them. They have depicted the ground situation in a very well manner. What I'm going to do is analyze situation at three levels. One, I was very concerned about science, the science of public health, science of medicine. What has happened in last 1 year of pandemic to the scientific temper, the scientific way of making policies. Second thing that I would like to look at is that the pandemic has created restrictions, and how these restrictions are being imposed. To what extent ethics and human rights are kept in place while doing it. And third is vaccine. I hope I will have time to cover vaccine fully, but the first two are very important and close to my heart. In public health, when I learned very early when I was a student, where there is a saying by Rudolf Virchow, a well-known European, German pioneer of the public health, that the medicine is social science and politics is medicine at a grand scale. So all of us, as a part of the public health movement, wanted a political will to implement the public health, to change the health scenario by having a political will to implement the right kind of public health programs. What has happened in last 1 year of pandemic is that yes, what looks to me is that there is a politics in command, but it is politics not to implement the science of public health or science of medicine, but it is for the politics, for the heck of politics. It is usurping the space that science should have, or a public health should have had during in last 1 year, is taken over by the political consideration without any kind of science there. I think that is the most worrying part, and that is the biggest gap. And I don't know how in future we are going to fill it up. Look at, Abantika and Banjot, both of them were talking about said opacity, no transparency. Why no transparency? Because they don't want to tell you how they are taking decisions. How did Prime Minister come to a conclusion that this pandemic will be fought in 21 days? Who advised him to do it? Or he did it on his own? Even if he had advisors and we see them day in and day out, are they real public health experts who have a say in the policy making? I think this is a big challenge for the media. Media need to find out who were deciding policies. Politicians on their own, keeping in mind their own constituencies, or they were led by science. Because cases that I see, they are pediatricians, they are heads of the institutions who had nothing to do with the public health, or people like big corporate hospital doctors who have always done clinical medicine, have no understanding of the public health, or Devi Shetty kind of people who have made money in the clinical medicine and do not have the kind of public health grounding that is required. You will find that even on vaccine issue, if you remember a controversy, that a vaccine committee of scientists of the ICMR, headed by Gagandip, Kang, was sacked. Gagandip was sacked, and the entire vaccine committee was sacked. So it seems as if government is afraid of science, of real public health people. It is being led by those who are sycophants, who are not ready to tell the government that what is the scientific way of combating this pandemic. And I remember one instance a few months back when sero survey was done, and this government control went to the extent of censoring or a paper on sero survey in Indian Journal of Medical Research. And there were there were authors of those papers who came in public saying that the director general of the ICMR told them, who was one of the co-authors, he told them that I have got orders from above that certain data you cannot present here because that will prove that this pandemic is now having community transmission. We are having a mass vaccination program without formally government ever accepting that the community transmission is taking place. So this is a policy making, and I think we need to see more into it so that we can correct it at some time. The second area of my interest is what I said, restriction and incentive. Who are restricted and who are incentivized? I think that is very important in pandemic times, because the public health perspective as well as legal perspective provide power to the state to take restrictive action in order to do good for the people. Now, who are restricted? People's civil and political liberties are restricted. People who are dissenting, they are restricted. They may be put in prison. They may be, it was said that police is the major implementer, and they were using these forces. But people are restricted, while those who have power, they are not restricted. Look at the situation in Maharashtra. Last year as well as now, when the resurgence of the infection has taken place, we still do not take over the health system. Yeah, Abantika was talking about private sector and private sector doing more in it. But if my liberty can be taken away, why can't the private sector's liberty be taken away? The right to profit be taken away? I mean, if this pandemic is a threat to humanity, then humanity, which is the victim of this pandemic, can be restricted, but the big actors of the humanities, they cannot be restricted. How can that be the logic? And how do we swallow that logic, saying that, well, let them do what they are doing? And government, when they make allocation of money, they incentivize all these people. People who control the production, who control the employment of the people, saying that if you give more money to them, they will create employment. They have created nothing, right? So why aren't you giving directly to the people? Why aren't you taking our services? Why in Mumbai city, when there is so much of problem about beds, there is no centralized triage system? There is an emergency room, I know, you can call there, but there is no control of all the beds of all the hospitals. Why shouldn't be it under one central control in the Mumbai city? And the triage should be according to the medical need. Sachin Tendulkar could not occupy a bed if he's having mild COVID. And for that reason, even not Amitabh Bachchan. I think this is where we need to see that who is restricted and who is being incentivized. The other part is that when you restrict somebody, public health ethics and the public health laws that say very clearly that you have to reciprocate. If you do not allow me to go and work, you have to provide my wherewithal, what I was earning at the time when you restricted me. That thing you must provide me. That is my food, my water supply, my better housing. All those things is the responsibility of those who are restricting your movement and your work. In addition to that, there is also a requirement, and that is that you should have due process. This restriction cannot be used in a discriminatory manner, and it was used. That the Muslims were really made villains this time last year. This was done simply because there was no restriction, there was no due process involved at all. The court should become more active and not only be more active at the Supreme Court level, but even at the grassroots level, where the police, if it is doing restriction and doing it in a wrong manner, can be pulled up, but that nothing happens. So that due process was missing. How to get redressal of one's problem, that was missing. So these are the issues very important for me in the public health ethics as a public health activist. That yes, you can restrict, but you have to restrict in the manner which has the science behind it, and when you do it, you have certain obligations for towards the people. You cannot incentivize a political process the way it is being done. Lakhs of people can gather, and our politician, including Prime Minister, go and address them. And at the same time, after 2 hours, you see the same person telling us about keeping distance. How does it work? It doesn't work. It shows the hypocrisy of the entire political class. It is not based on science. It is based on political expediency. That is wrong. I think that is the second part. My last part is about vaccine. I think Banjot has covered a lot. There is an inequity in access. The way clinical trials were conducted, we all know about. Apart from giving Covaxin, I'm just concluding a couple of minutes. Apart from that, it is also the issue of who are able to get and who are not able to get. We have created the process which is such that the poor people who are eligible, they are not able to access it. I think this needs to be corrected immediately. The another important thing is that we are exporting vaccine. More than 60% of the vaccine production is exported when we are having a scarcity here. So why is it being allowed to happen? And why we did not make arrangement for the production that we need here? And the last thing that I would like to say is that the entire Europe is shaken by the deaths in the Covishield vaccine, that's the AstraZeneca vaccine, which is causing, in a very small number of cases, the clotting of the blood and at the same time lowering of the platelets. Both of them happening simultaneously is a very peculiar outcome of people who have taken vaccine. I think Indian committee, which is monitoring the adverse events after immunization, seems to be highly incompetent. They are not able to really do competent pathological investigation to find out that those causes of death where persons have died because of, say, cardiac arrest or myocardial infarction or pulmonary cause or cerebral stroke, they had clots there or not. Why they are not able to do it? We have science, we have scientists who can find out. Are they really tapping into them? Who are the people who are sitting in the committee? Do they have really some good competence to investigate this kind of death? I think these are the very important issue, and this thing needs to be filled up because these deaths are going to be reported, and that is going to add into the hesitancy. The more opacity on the deaths and the serious events is going to lead to more hesitancy because people will feel that Prime Minister tells us to take vaccine, but there is nobody to help us if vaccine causes some problem. There should be an understanding that if vaccine causes some problem or post-vaccination, any problem takes place, irrespective of whether it is related to the vaccine or not, those people must get best services. I think that gap needs to be filled up if you want vaccine to be acceptable to everybody. Thank you very much. I'll be
Thank you.
interested in
Thank
getting
you so
some
much,
questions.
Amar.
Yeah.
Yes, I think the point about restrictions and incentivization is something that we are going to now face, especially with all the reports of rising cases in UP as well as in areas where there have been large election rallies. Uh, there are a number of things that we still need to discuss, and I'd like Mr. Keshav Desiraju to come in here and explain to us how he sees the way the government has responded, people within government who have taken policy decisions, where the gaps have been even in this. Mr. Desiraju.
Thank you, Geeta. Thank you, Media Foundation, for asking me to join this program. Uh, there's really very little to disagree with on all that we've heard this evening. And Abantika and Banjot are people on the ground with a very keen sense of what is happening, and one has to admire the work they're doing. I'll try and be quick. Abantika had a useful way of addressing this whole issue by saying, what are the gaps? Now, she did not talk about infrastructural gaps because so much has been said about it. But I think the important thing is, while we recognize that there is a gap in public funding of health systems and the public health system at large, not very much has been done about it. People who have looked at this year's budget figures have come back to say that there's nothing very special. Uh, Given what we have learned about how important it is to have public health workers on the ground, we do not seem to have responded appropriately to that. She also identified three other gaps. One in the area of public health communication. Banjot also spoke about this. Have we improved? Now that the problem has been identified, have we improved in our communications? Again, the answer has to be no. If you just look at the considerable confusion today about vaccinations, what should the gap be between the first and the second? Has Covaxin got the same level of clearance that Covishield has got? If India has a shortage, why are we exporting? Why did we decide to export to start with? And again, one important area that has not really come up for discussion is uh, government itself has captive facilities both in Kasoli and in Kunur for vaccine manufacture. What exactly is happening in these places? Huge investment has gone into these in the last few years. We knew about this time last year that we should have known that we will be needing vaccines on a large scale in the time to come. What has happened in those two institutions? Are we going to be always dependent only on uh, manufacturers outside government? The whole point of having captive facilities in government is that you are not, in the end, dependent on an outside source that could dry up, as indeed it appears to have dried up right now. So I think that's a whole gap area that we have not addressed. Urban health, she identified as a gap area. Very true, but have we done anything about it? No, not obviously. She also talked about the private sector and how the reluctance of the private sector to get involved has become very clear. Have we learned a lesson from this? No. As far as I know, Ayushman Bharat continues to be the mainstay of this government. I have seen nothing which suggests that that model of insurance-based, private hospital-based healthcare is going to change. So there are these very, very important gap areas. The gaps will always be there. What is a pity, a tragedy even, is that we don't seem to have learned from what we know about these gaps. Then there was a lot of talk, Amar spoke about it, Banjot spoke about how poorly in Indian medical research, medical science research has shown up through this last year. And I think this is undeniable. And I want to say something that may cause, people won't like my saying it, but I think it's not just a question of the scientific establishment crumbling under political or bureaucratic pressure. I'm also beginning to think that our scientific structure is basically incompetent. That even without political pressure, we really are not up to much. Now, there are reasons for this. Years and years of underfunding, years and years of not being listened to, years and years of people in the scientific research area being kept out of the decision-making process has probably resulted in this. So what we do have in the shape of a science research, a health research system is basically incompetent. And it's going to take a long while for us to come out of that. Now, there was another very important point that Banjot made about gaps that we cannot see, and she spoke very, very correctly about children under 1 year who have lost out on universal immunization, or under 6 who have lost out on whatever they were getting in the ICDS centers, or children who have missed out on midday meals at school, apart from whatever learning they were supposed to be doing at school. And the kind of study which she said needs to be initiated, I mean, we hope it is being done. Seems unlikely. Maybe some states are working on this, but that has been a big blow. But there are other areas of gaps that or blows that are not so publicly known. One is the increase in domestic violence, the lack of access to family planning methods, and increase in instances of mental illness. All three documented. So where Banjot spoke about children in schools, I think we should also look, these areas affect women largely, violence and access to family planning methods and increase in mental illness. It's something that is extremely worrying. Another gap area is that what have we learned from the migrant movement of last year? Have our municipalities, our civic municipal systems been even thinking about setting up social security networks in the cities for people who are living and working but do not belong there, who do not have a home there, and who in a crisis like last year just have to go back home, wherever home is. So for people who are living and working in the cities and towns, as it is, they're living on the margin. They are not living at home. We know what can happen in a crisis. This is not this thinking is not necessarily something that should happen within health policy administration. This should be happening in municipal administrations and urban development kind of people who look at that area of public policy. What do India's towns and cities need to do in order to protect people who are residents of those towns and cities but have no other sort of support system? And I think the last thing I would like to say is that it's also very sad that we are still asking many of the questions we were asking last year. There is still talk about, should India go into a lockdown again? One way or the other, we should have answered this question. But we don't seem to have done that. And it's we haven't made the investments we need. We don't seem to have learned the science. We don't seem to have learned the communication methods. And while we may be better off than we were last year in handling whatever situation is upon us, we are not substantially better off. And that, I think, is an enormous pity. Thank you.
Thank you, Mr. Desiraju. I think it's really important that I'm so glad that you flagged issues of violence and mental health, as well as of public funding for infrastructure, which is really at the base of so much of our struggle to have better public health. Um, about migrant movement, it's important to even understand what happened to migrants when they did go back to their homes, and whether the virus went back with them, whether they came back. Because many of them say that they did not experience anything in the rural areas that they went back to. But we have a few questions that we'll very quickly go into now. Mr. Desiraju, how do you see center-state relations in terms of vaccine distribution? There are questions for all of you, but first for Mr.
Well,
Desiraju.
my very quick response to that was there is really no need for this to be controlled centrally. I mean, if the vaccine manufacturers are free to sell abroad or to sell privately, there is
Yes,
absolutely no reason why they cannot get into arrangements with state governments. Uh, I'm not sure why this has been done. Maybe because of want of time, a system had to be put through. But there is, to my understanding, there's no reason why state governments should not really decide uh, which vaccine they're going to get and where they're going to source it from. I don't know what the exact current funding arrangement is. Who is paying for this? Is it center and state? Are they both sharing the cost? Is it 100% borne by the center? That is not very clear. But if it is being treated as a kind of centrally sponsored scheme in which center and state are sharing the costs, certainly the states, and as we all know, it is a state subject, the states ought to have the ability and the authority to source their own vaccine. But it's not happening right now.
okay. There's a question there are two questions for Amar here, and one more for Mr. Desiraju. So please stay
But
here.
that's not good.
Um, Amar, there's a question for you. Is the private sector not discharging its corporate social responsibility? Question one. And the other question comes from Dr. Meera Shiva. Your comment on 40 doctors in KGMC in Lucknow testing positive in spite of having taken 2 doses of the vaccine. So, two questions.
Well, the first one is a very important one because I think Mr. Desiraju also told us that the public financing is very, very important. Now, that is also related to what I was talking about the private sector. I think you can have multiple sectors. I have no problem, provided all the sectors are coordinated and are under the control of the public authority. You go to the Europe, you go to the Western Europe. Uh, you don't see accepting where there are national health services, but in the rest of the European countries, you have a lot of private providers. But all of them do work under the guidance and the control of the government or the public authority that they have created. And there is a big chunk of financing going from the government for that. And this pandemic was the biggest opportunity to do it. That would have disciplined the private sector. That would have ensured that there was some kind of complementarity between the government services and the private sector services. And wherever necessary, where the private sector refuses to do it, government has power to take over the private sector. Why can't they do it? Right? If they can arrest me and put me in prison for violating their orders, they can do the same thing to the CEO of the private sector. So that is it. Second point that you have asked me is about
Yes.
testing positive. Now, everybody knows that these vaccines were tested not for prevention of the infection, but they were tested for reducing the intensity of the disease, that is COVID. The SARS-CoV-2, that is the virus, that will continue to infect us. But after we get infected, it will not have an effect of this kind. And that is the first part. Second part is that all this vaccine, Covaxin and Covishield, they are not 100% effective. So there is a 75%, 80%, whatever is there. So there are going to be instances where not only they will get infected, but they may also turn into severe disease. So we'll have to keep that in mind. We can't lie to people saying that vaccine means you are absolutely right. Nothing is going to happen. No, that is not the way. Science tells you that vaccine also has their own limitations.
Okay. The questions for the journalists, Banjot and Abantika. One question is, can you comment on the quality of reporting during the pandemic? And I'd like to add to that and ask how easy or how difficult was it for you to access information from the government? Um, Banjot and then Abantika.
Well, to talk about the quality of reporting, I leave it to the readers who read our stories, or to the viewers who listen to the TV journalists. I really, I don't think. But one thing I can say, and I can say with fair degree of satisfaction, that when there was a crisis of media credibility all around, health journalists stood up and asked some of those questions which government would not have expected to be asked. So I do say with that, I think health journalists tried doing their bit and they were not so unsuccessful in that. Rest I leave to the readers and to the viewers. Second, you asked about how easy or not so easy was it to access information. Well, it was very difficult. To be very honest and to be pretty frank, it was very difficult to access even the basic numbers. I mean, even, if you ask, I asked in a press conference how many samples have been sequenced before they, started giving this data. The whole process of sequencing was explained, but this one particular question, that how many samples have been sequenced, was not explained. And then I had to run from pillar to post to get access to that data. This, when other countries are, you look at the UK data, they have a website telling how many samples have been sequenced. So it was really difficult, and it still remains really difficult to access information, even basic information.
Okay. Abantika, before you answer, there's another question from Amu Joseph about, it says, thank you for the mind-blowing clarity of your presentations. Could you talk a little about what media organizations and institutions of media education can do to improve healthcare coverage, especially coverage of public health during pandemics and at other times?
Can I talk first a little bit about your question on how difficult?
Yeah, please switch off. Okay. Yes, please continue.
Yeah. So, can I just to add to what Banjot said on information availability? Actually, it was difficult to find information that had a story to tell. It was very easy to be inundated with unnecessary information, unnecessary quotes, unnecessary. I mean, I have never seen. I'll just give you a small example. This health minister's statement day before on Maharashtra, that was 4 pages long. I mean, I read the first page and then I said, but this is not over. It's a statement. And then I said, see, it's 4 pages. So it was basically difficult to get meaningful information. There was no dearth of information. And I think one of the strategies was to sort of just drown us in information and leave us, and we work on deadlines. We are always in a hurry. Leave us with no time to have any sort of discretion on what to write, because I mean, if you have a ready press release of 2 pages, you will just copy paste. I think that was the difficult part, really, more than getting information.
Okay. This question comes from Goa, from Usha Bhasin. It says, we have failed in creating awareness about the critical importance of small behavior changes, masking and social distancing. No lessons from the polio campaign. Amar, would you like to take that question? How do we learn from other, actually, how do we learn from other campaigns? The HIV epidemic, the fight against HIV, for instance. We don't seem to have learned anything from any of those, or is it that, nobody wants to listen to the health activists who have been fighting these?
Well, I think if the idea is to change people's behavior, now behavior is a very very difficult thing to change, and just providing information is not going to change the behavior of anybody. Sometimes information in itself could lead to the wrong kind of behavior. I remember long back a campaign on leprosy, where they started telling people that if a small patch on the skin, that was 1980s, can be leprosy, then the stigmatizing part of the leprosy spread all around. Even people who were having some kind of fungal infection, they started getting stigmatized. So what you have to do is that, in along with the information, you have to create an environment and enabling conditions for people to change the behavior. That happens provided you see that those who are asking you to do it, the state, the public health administration, and all, they are very serious about it and they themselves follow it. I think one of our journalists told us that they tell people to change their behavior, but they themselves don't do it. They go out and have a meeting of lakh people or 2 lakh people, and they continue with that process where there is no distancing and ask us to distance. Now, how are people going to look at it? They say that, well, is this science or is it political expediency? That's what I was saying in my opening statement, that we wanted politics to implement public health. Here it looks like that public health is put aside, science is put aside. Then how do you change the people's behavior? You can't. We have a lockdown without knowing that there are people who are daily wages and they will starve once we do it. If you don't make an arrangement and then say why they are running around and spreading disease, what can they do when they are hungry? So I think those enabling condition, if we don't talk of, we will not be able to change. I mean, we have learned from HIV, we have learned from smallpox, but in all of them, where there was a magic bullet, a drug was discovered, or we had a smallpox vaccine there and all. That was used as a way of doing, but there are no magic bullets when you talk about social behavior of the people. That comes about by making
And, and I
creating an
guess
environment for changing it. You see.
And I guess we have to start from the very, very basics. And that is the question, our last question actually for today, which is to Mr. Desiraju. It comes from Sonalini in Mumbai. It says, are we in all likelihood going to miss the opportunity to critically examine our primary healthcare readiness? Because that is ultimately the basis for a public health, which, that one
Uh,
can build
Thank
public.
you. The thing is, though, there is a lot state governments can do about getting the primary health network into order. We always talk and we believe, and actually NRHM, subsequently NHM, led us to believe that substantial upgradation, substantial financing has to only come from the center. That's not necessarily true. State governments can, in the past, have often shown the ability to generate their own resources, state funds, and primary healthcare is totally within the state government's purview. It is for them to do. Setting up of government medical and nursing colleges is again something state governments can do. State governments need to understand that if they want to control the narrative, they need to be putting more of their own money into it. The famous 3% of GDP includes both central and state funding. So that state funding is there. And I think to answer to the question, while the government of India may not be doing substantially more than it has done towards strengthening primary health systems, state governments can and should do it. And if I have a minute, there was a question you asked that wasn't answered as to what can media foundations do, what can media houses do.
No.
I think that's very simple. They should fully support their journalists on the ground. I think that's all that is expected of these big media houses. But
It's wrong.
stand by your journalists, the people who are, you know, uh, running around getting stuff out into the public domain, telling people what is going on. You need to cover their backs. I think that is something they need to do. Thank you.
They
Thank you.
need
Thank you for
protection, I
saying that.
think. Yeah, there is a
Thank
lot
you
of
for
attack
saying
on
that. That's
journalists.
absolutely important, especially when we've had so many journalists who've lost their jobs in the last year. There are so many other questions, and we really have to take one from which is addressed to both Banjot and Abantika. They would like to know any comments on frontline health workers who are mostly women. And actually, we've really not discussed the impact of the pandemic on women, and especially women frontline workers who had to deal with so much of what you all talked about in terms of public health care communication. And so, Manjot, Avantika.
Uh, I think most of us would recall that it was in the middle of the pandemic that the ASHA workers had to stage an agitation to demand their dues.
Yes.
This was when ASHA workers were asked to go when migrants were moving from larger cities to smaller towns. It was the duty of ASHA workers to go from home to home to do the primary screening, mostly without adequate protection against the virus. So they were doing a job which could have really, they could have lost their lives doing that. And still they had to stage agitations to demand their dues. This was really shameful for us as a society. Overall, if you are asking about the impact of the pandemic on frontline workers, which are yes predominantly women, I think that while it came about vaccination, they were a form of priority group. But have we given them their due in the past? Because we heard stories about doctors. Did we hear adequate stories about frontline workers? That I think was not the case, and I think we should take as media persons we should take responsibility. There were stories, but there was not adequate coverage of frontline workers and the effort that they had put in this pandemic.
Avantika, what would you like to say on this? Sorry,
She's muted.
you'll have to mute.
Yeah.
Yeah.
So no, I completely agree with Banjot because we haven't told their stories enough. Possibly also because all of us are based in cities and we did not actually see them. That was one of the problems, as I mentioned in the beginning, that we did not have these workers in the cities. That could be one reason. Um, Also, I think another reason could be because now when it's actually spreading to rural areas, and I have a feeling we'll be doing this for several months now. I think more frontline workers will start getting highlighted now. Stories will possibly come out because the disease is now spreading to rural areas. That's my guess.
Geeta, can I add one point?
Yes, please.
I think both of them have raised the issue, and that is ASHA workers and auxiliary nurse midwives. All of them are women, and but in addition to that, in the urban areas, we should also look at the nurses in the hospital. And I think the first controversy about women workers not being provided adequate protection in Mumbai city started with the plight of nurses who were not given PPE, but the other higher level health workers were given, because 96% of our nurses are women. In addition to that, you'll find that more than 50% of our doctors are women. So there is a feminization of medical workforce in a big way. So I think we need to get more information both about nurses as well as the women doctors and what happened to them during this pandemic.
Geeta, very quickly, just one quick remark.
Please do. Please
Yeah,
do.
I think one more missed opportunity. Another question that we've not answered is what was just raised. this was the opportunity to discuss this whole Asha story. Will the Asha only continue to be an incentivized worker? Will she be some kind of honorarium based worker? Will she be a government servant? How much training does she need? Are we finally going to recognize that she is the foundation of the public health system? This was the time when for these questions to be asked and for money to be found and decisions taken, but we have completely ignored it. Just one more of the many things that we have learned but ignored.
Correct. There are questions. Uh, Dr. Pachauri has a question, SK Pachauri. Can we expect a miracle cure of the disease from Indian scientists? And I'm actually wondering which disease now we are talking about.
I already said I thought they were incompetent. So, I mean, someone else must answer this question.
So the disease of incompetence, the disease of lack of communication, the lack of transparency, these are all also absolutely things that we need to address if we want to even get down to the real issues. I'll have to end this session today. I mean, we still have many more questions, but I'm hoping that we can direct them to all our panelists, uh, and hope that we can get. Would all of you like to make one very brief closing comment? I think I can see Abantika wants to say something, and then I'd like to.
No, I wanted to respond to that miracle cure part. The way we have gone from immune boosters to coronil and all that, right now, leave alone miracle. I would make do with a scientific cure.
Absolutely. Okay. Thank you all. It's been very important, and I don't know how many answers we still have left, but we've given ourselves a number of questions and a number of issues that we still need to cover. Thank you for being here, and thank you for helping us to navigate some of this. Thank you very much.
Thanks a lot. Thanks a lot for inviting. See you. Bye bye.
Bye, Amar. Bye, Abantika. Bye, Banjot.
Bye, sir.